Picture this: a quiet afternoon in Texas. A 67-year-old grandmother, let's call her Carol. Her entire life she has been accustomed to aches and pains. Back pain from gardening, weary knees from playing with her grandchildren, and today it's a pain in her shoulder blade. She thought I probably just slept on it wrong last night. A very ordinary pain, a minor nuisance that millions of us, especially women, often tell ourselves we have to endure and get over it. But this pain was different. It didn't flare up and then subside. It was a dull, persistent ache, a heavy feeling weighing on her shoulder like an invisible stone. When her daughter visited and saw her mother grimacing, she insisted that she go to the hospital. Carol brushed it off. "It's just a muscle ache, it will be gone in a few days. Don't make a big deal out of it." But her daughter persisted. And that trip to the emergency room changed everything forever. What the doctors discovered after performing a few simple tests left the entire family, who had always considered her a steadfast pillar of strength, stunned into silence. I will tell you the exact horrifying secret behind Carol's shoulder pain in just a few moments. But first, pause for a second and ask yourself, is it possible that you or the mother, the wife that you love, are also making the same fatal mistake she did? The warning signs of a silent heart attack are being ignored every day, and recognizing them right now could be the difference between life and death. To understand what happened in the hospital, we must go back in time a few weeks prior, because Carol's body had been speaking, but she hadn't been listening. First, there was the fatigue. This wasn't the usual sleepiness after a hard day's work. This was a bone-deep exhaustion, a fog that clouded her mind, making it impossible to concentrate. Reading a chapter of a book, her favorite pastime, now felt like a burden. She told her husband, "I'm just getting older, dear." She believed it just as millions of other women do. They accept fatigue as an inevitable part of aging, not realizing it can be one of the most common heart attack symptoms in women. Next was her sleep. Carol, who had always prided herself on being able to sleep soundly anywhere, began to experience strange insomnia. Every night she would wake up around 2 or 3 a.m., not because of noise, not because of nightmares, but from a sense of restlessness, her heart pounding in her chest. A nameless anxiety would wash over her in the dead of night. Again, she rationalized it to herself. "I'm probably just worrying too much about trivial things." Carol did what so many women are taught to do. She prioritized her family's health above her own and downplayed what her body was trying to tell her. She was afraid of bothering her children and grandchildren, afraid of being seen as weak. Her body's warning whispers were drowned out by seemingly logical excuses. Her story is not an isolated case. It is a silent tragedy playing out in countless families across America, where wonderful women are unintentionally gambling with their lives. Carol's story is the perfect illustration of a dangerous misconception that has persisted in medicine and popular culture for decades. When we think of a heart attack, what image comes to your mind? Almost certainly, it's the Hollywood heart attack. A man suddenly collapsing, clutching his chest, his face contorted in excruciating pain. And yes, severe chest pain. The feeling of a crushing weight is the most classic symptom. But here is the problem that is the classic symptom of a heart attack in men. For women, the picture is often completely different. Studies from the American Heart Association and many other reputable organizations have consistently shown that women are far more likely to experience a heart attack without any distinct chest pain at all. Instead, their bodies send out more subtle signals, whispered warnings, instead of shouts. To see the difference clearly, try to imagine it this way. A man's heart attack is often like a lightning strike, sudden, intense, brilliant, and impossible to ignore. A woman's heart attack symptoms, however, are more like a slow-burning fuse. It smolders internally, producing light smoke in the form of fatigue, small sparks in the form of insomnia, and a rising heat in the form of anxiety long before it actually explodes. This difference is a deadly trap. Because we, both patients and sometimes healthcare professionals, are programmed to look for the lightning strike. When a woman comes to a clinic and says, "I just feel tired and have some trouble sleeping," the alarm bells in our heads don't ring as loudly as when a man says, "I have severe chest pain." We miss the smoke because we are busy looking for a large fire. That is why the warning signs of a heart attack in women are so often misdiagnosed as stress, an anxiety disorder, or simply due to aging. And this brings us back to the emergency room in Texas with Carol. The doctors there, after hearing her story and noticing the atypical symptoms, began to suspect something. But what surprised the doctors most was not the vague symptoms themselves, but what they discovered after performing an echocardiogram. It didn't match what they were expecting. It was a completely different piece of the puzzle, an alarming truth about how women's hearts are at risk. I will elaborate on that shocking discovery later in the video. For now, let's delve deeper into the first three whispering symptoms. Let's dissect the first three signs, the most dangerous silent culprits. We need to understand them thoroughly to feel them so that we never downplay them again. Symptom number 1. Extreme fatigue. I want you to immediately dismiss the concept of ordinary fatigue from your mind. This is not the feeling of sleepiness you get after a long day of looking after grandchildren or overworking. This is a state of physical and mental exhaustion. A famous study published in the journal Circulation surveyed 515 women who had survived a heart attack. The results were shocking. Up to 80% of them reported experiencing unusual, unexplainable fatigue for at least 4 weeks before the heart attack occurred. Picture it like this: you wake up after an 8-hour sleep, but feel as if you've been awake all night. Your energy is like a phone that won't fully charge, even though you've had it plugged in all night. It remains stuck at 10%. Activities that were once simple, like walking the dog, cooking a meal, or even taking a shower, now require an extraordinary effort, forcing you to sit down and catch your breath. This is not laziness. This is not a sign of old age. This is a biological cry for help. It's your body struggling to pump blood through gradually narrowing arteries, and it's consuming all of your energy reserves. Symptom number 2. Feelings of weakness or dizziness. This symptom often comes on very suddenly in episodes. You might be standing at the sink washing dishes, and suddenly a wave of weakness washes over your body. Your knees feel shaky, your hands tremble. Or you feel lightheaded, as if the world around you is tilting, forcing you to grip the kitchen counter to keep your balance. This feeling is often accompanied by a sudden onset of anxiety for no specific reason. Your heart might start to race. This is the dangerous intersection where a panic attack and a heart attack can be confused. However, the physical weakness, the feeling that you are about to faint, is a crucial differentiator. It indicates that your heart may not be pumping enough oxygen-rich blood to your brain. Pay attention to these moments. Never dismiss them just because they only last a few seconds. Symptom number 3. Sleep disturbances. This is perhaps the most frequently downplayed symptom because all of us experience sleeplessness at times. But cardiac-related insomnia has its own unique characteristics. Nearly half of the women in the study I mentioned reported sleep problems in the weeks leading up to their heart attack. It's not just difficulty falling asleep. It's often about waking up suddenly in the middle of the night, usually around the same time, for example, 2 a.m. You are suddenly wide awake, your heart pounding. You weren't having a nightmare, nor do you need to use the restroom. There is just an indescribable feeling of restlessness and anxiety. Alternatively, you might feel exhausted, yet unable to sleep, just tossing and turning for hours. This is a sign that your autonomic nervous system, the system that controls your heart rate and breathing, is under stress due to cardiovascular issues. And before I tell you about the next 3 signs related to pain and breath, try to recall when was the last time you had a sleepless night for no apparent reason. You might have been warned without even knowing it. These 3 symptoms we've just discussed, fatigue, weakness, insomnia, are like silent warnings. But what happens when those warnings are ignored, not just by the patients themselves, but also by the healthcare system? To understand that danger, I want to tell you another story, the story of Sarah. Sarah was a high school history teacher, a sharp woman who was always in control of every situation. For about a week, she had been feeling a dull upper backache and a sensation of nausea that came and went. She thought she had been grading papers for too long, or that it was due to a rushed lunch. Finally, to put her husband's mind at ease, she went to a private clinic near her home after work. She walked in and described her symptoms calmly. She said, "I think it's probably just stress, doctor. It's a busy time at work with the end of the year." The doctor, a cautious man, conducted a general checkup. He measured her blood pressure, listened to her heart and lungs, and performed an electrocardiogram (EKG). A few minutes later, he returned with the results. The EKG strip showed no abnormal signs. Her heart rhythm was regular, with no clear evidence of ischemia. He concluded that it was most likely muscle spasms and indigestion caused by stress. He prescribed her some muscle relaxants and advised her to rest. Sarah breathed a sigh of relief. The vague anxiety in her heart dissipated. She thanked the doctor, paid the bill, and walked out of the clinic with a smile. Everything was fine. But just as she reached her car, something terrible happened. A shortness of breath hit her, as if someone had sucked all the air out of her lungs. A cold sweat broke out on her forehead and the back of her neck. Her chest tightened. She had to clutch the car door tightly to keep from collapsing. Sarah was not having a pre-infarction. She was experiencing a full-blown heart attack, one caused by a coronary artery blockage. Right there in the parking lot, just 5 minutes after being told she was perfectly fine. At that moment, the doctor in the clinic hadn't missed anything. He had followed the proper procedure. The EKG strip at that time was indeed normal, but there was something that neither he nor Sarah knew. 24 hours later, when Sarah was in the intensive care unit of a major hospital, the results of a troponin blood test, a protein that is only released when heart muscle is damaged, revealed an extremely dangerous truth. See, Sarah's sky-high troponin blood test result confirmed what the initial EKG strip could not see. A part of her heart muscle had been damaged due to a lack of oxygen. Her heart attack was real, and it had been heralded by the very symptoms that both she and her doctor had downplayed. Sarah's near-tragic story teaches us an invaluable lesson about the next 3 signs. Let's examine them closely because they are the most clever imposters. Symptom number 4. Upper body pain. This was the very symptom that brought Sarah to the clinic, the dull upper back pain. Forget the classic image of someone clutching the center of their chest. For women, cardiac-related pain can appear in very unusual places. It can be jaw pain, which is easily mistaken for a dental problem. It can be a tightening or pressure in the neck, as if wearing a tie that is too tight. It can be a sharp pain, a dull ache, or a heavy pressure between the shoulder blades, an extremely common symptom in women. And of course, there is arm pain, a feeling of heaviness, numbness, or a pain that radiates down from the shoulder. Why does the pain radiate like this? Because the nerves from the heart and the nerves from these other body parts all converge at the same point on the spinal cord. When the heart is damaged, the brain gets confused and cannot pinpoint the exact source of the pain, leading it to interpret the pain as coming from the arm, jaw, or back. Symptom number 5. Cold sweat. The sweat that Sarah experienced in the parking lot was not from heat or exercise. This is a survival response from the body. When the heart isn't pumping enough blood, the nervous system activates the fight or flight mode. It releases adrenaline, which constricts the blood vessels in the skin, causing it to become cold and clammy. A sudden cold sweat while you are at rest, especially when accompanied by nausea or dizziness, is an extremely serious alarm bell. It is never normal. Symptom number 6. Shortness of breath. Shortness of breath, or what is medically termed dyspnea, is another core symptom. The heart and lungs are a tirelessly working pair. When the heart weakens and cannot pump blood, effectively blood can back up in the vessels leading to the lungs. This pressure can cause fluid to leak into the air sacs of the lungs, resulting in shortness of breath. You might feel winded, even while doing very light activities like talking on the phone or walking from one room to another. Another characteristic sign is shortness of breath that worsens when you lie flat, requiring you to prop yourself up on many pillows to sleep or to sit up to breathe. This is a clear indication that your heart is struggling to handle the body's blood volume. We have just seen the story of Sarah, a woman who nearly lost her life because her symptoms were downplayed. But there is an even more frightening psychological aspect to her story, something that many other women do every day. It is the act of self-deception. While sitting in the clinic, Sarah told the doctor, "I think it's probably just stress." She actively downplayed the severity of what she was feeling. Why? Because society, family, and sometimes we ourselves have taught women to be strong, to endure, to put the needs of others first. They are afraid of being seen as complaining, afraid of bothering others over something that is probably not serious. They find their own logical-sounding reasons to explain their feelings of unease. It must be indigestion. It's probably the weather. I'm likely just too worried. This act of self-reassurance is an extremely dangerous psychological trap. It not only provides misleading information to the doctor, but it also creates a barrier preventing them from seeking help in the first place. She didn't just deceive the doctor. She was also deceiving herself, believing in a false reality, that everything was fine while her body was screaming for help. And it is precisely this psychological trap, this pattern of symptom self-denial, that compelled Dr. Evelyn Reed, a cardiologist, with over 30 years of experience at a leading women's heart institute, to speak out. She has dedicated her entire career to studying the subtle differences in heart disease in women, and she realized that the biggest battle is not just fought in the laboratory or the operating room, but within the patient's own mind. What did she discover about the link between psychology and physical symptoms? I will let her tell you herself right after we go over the final 2 symptoms, the most clever imposters of all. The 7th sign. The number 1 imposter is digestive issues. It can manifest as persistent nausea, heartburn, indigestion, or a feeling of fullness or pressure in the epigastric region. Because it perfectly mimics common stomach ailments, this is one of the most easily dismissed symptoms. Many women have self-treated with antacids for weeks, while the root cause lies in the heart. This pain or pressure occurs because the vagus nerve, a long nerve connecting the brain, heart, and digestive system, is irritated by the heart's lack of blood, cardiac ischemia. And the 8th sign, as we have emphasized from Carol's story, is sudden anxiety and sleep disturbances. A sense of restlessness, a racing heart for no reason, and waking up at the same time every night are signs that cannot be taken lightly. Now we arrive at the core question. Why do all of these vague symptoms become exponentially more common and dangerous in women especially after they pass through a natural stage of life, menopause? The answer lies in a miracle hormone, a loyal bodyguard of the heart, estrogen. Think of estrogen as a plumber and a 24/7 security guard working inside your arteries. Before menopause, high levels of estrogen help keep the walls of blood vessels soft, flexible, and elastic. It helps control bad cholesterol. LDL increase good cholesterol. HDL and prevent the formation of atherosclerotic plaques. It is a natural cardiac protection mechanism, a gift from nature to women during their reproductive years. But after menopause, the ovaries stop producing estrogen. That loyal bodyguard retires. And without the protection of estrogen, a series of negative changes occurs. Artery walls become stiffer, blood pressure tends to rise, bad cholesterol levels can easily increase. The risk of blood clot formation also increases. A woman's heart suddenly loses its most robust protective armor. Their risk of cardiovascular disease doesn't just increase. It skyrockets to catch up with and even surpass that of men. This is a medical truth of vital importance that every woman and their loved ones need to understand. And now let's listen to the analysis from Dr. Evelyn Reed. Based on the thousands of cases she has treated, she has synthesized the silent risk factors that have the most devastating power. Dr. Reed emphasizes that beyond the classic factors like high cholesterol and high blood pressure, women need to pay special attention to the following three things. First, diabetes. Women with diabetes have a much higher risk of heart disease than men with diabetes. Diabetes not only damages the large blood vessels, but also devastates the tiny microvessels, causing the type of microvascular disease we saw in Carol. More frighteningly, it also damages the nerves, reducing pain sensation, which leads to the risk of a silent heart attack. A heart attack that occurs without any chest pain symptoms. Second, mental stress and depression. Dr. Reed affirms that the link between the heart and the mind in women is stronger than we think. Chronic stress and depression are not just emotions. They cause systemic inflammatory responses, increasing blood pressure and heart rate, directly damaging the cardiovascular system. And third, autoimmune inflammatory conditions. Diseases such as lupus or rheumatoid arthritis, which are more common in women than men, create a state of chronic inflammation in the body. This inflammation also attacks the blood vessels, accelerating the process of atherosclerosis. Understanding these risk factors is the first step to protecting yourself. And if you stay for 2 more minutes, Dr. Reed will share a simple yet powerful tool, an at-home assessment that helps you know if you are facing these risks. Dr. Evelyn Reed believes that knowledge is only truly powerful when it is applied. Therefore, she helped us create a simple tool so you can begin the process of listening to your body right now. This is not a medical test. It is not used to diagnose a disease. Consider it an honest conversation with yourself. A 60-second awareness checklist. Grab a piece of paper or simply answer honestly in your head. Question number 1. Regarding energy. In the past month, have you felt an unusual fatigue, an exhaustion that not even a good night's sleep could relieve? Question number 2 regarding sleep. Have you been waking up more than once a night with a feeling of anxiety or a racing heart for no clear reason, such as a nightmare or noise? Question number 3 regarding breath. Have you ever felt winded or short of breath while doing a simple activity that used to be very easy for you, such as climbing one flight of stairs or cleaning the house? Question number 4 regarding pain. Are you experiencing any new persistent pain in your jaw, neck, back, especially between the shoulder blades or in one or both arms, that you have told yourself is probably nothing? Question number 5. regarding sudden sensations. In the past few weeks, have you experienced sudden spells of dizziness, weakness, or broken out in a cold sweat when you were not physically active? Now look at your answers. If you answered yes to 2 or more of these questions, please do not panic. This does not mean you are having a heart attack, but it is an undeniable signal from your body. It is a red flag, and it means it is time for you to schedule an appointment with your doctor to discuss your heart health seriously. Bring these questions with you. They will be the start of a conversation that could save your life. And that brings us back to Carol. Thanks to her daughter's insistence and the dedicated care of her doctors, she pulled through. She was correctly diagnosed with microvascular disease and was treated with the appropriate medications. Today, she isn't just surviving. She is truly living. She can drive herself to her art class, and she can bake the apple pie that her grandchildren love. She was given a second chance. But thousands of other women have not been so lucky. They waited. They waited for a clear, movie-like chest pain. They waited until the symptoms became unbearable. They waited until it was too late. I am here to tell you with all sincerity, Les, do not be one of them. Don't wait for the first pain. Don't wait for a dramatic moment that may never come. Your body is talking to you right now through the whispers of fatigue, the sleepless nights, the vague aches and pains. Listening to those whispers isn't weakness. It is wisdom. It is strength. It is the bravest thing you can do for yourself and for those who love you. Because this isn't just about preventing a heart attack. This is about protecting your future. Protecting the peaceful Sunday mornings, the holiday gatherings, the warm hugs from your family. Your future is calling, and it wants you to be there healthy and whole. Today, we have learned important truths together. First, the 8 signs of a heart attack in women, from extreme fatigue to digestive issues. Second, why they are different. Remember the image of the slow-burning fuse. And third, the fatal mistake of downplaying your own symptoms. If this video has brought you value, I sincerely ask you to do something incredibly simple, but with a massive impact. Hit the share button. Send it to your mother, your wife, your sisters, and your best friends. Your 10-second action could give a woman you love 10 more years of life. And don't forget to subscribe and hit the notification bell, because in the next video, I will reveal the 5 morning drinks that help protect heart health. After 60. Be wise, be strong, and most importantly, listen to your body. Thank you for watching.